This week we're going to talk about the female reproductive system. So the reproductive system is responsible for supporting conception and pregnancy, so reproductive health, influenced by hormones. Female hormones are estrogen and progesterone. Those influence the maturation and overall reproductive health, along with influencing many other body systems important for overall health. The female reproductive system is composed of internal and external organs, structures, and glands, which we will get into in the upcoming slides. On this slide, you see a cross-sectional view of the most of the female reproductive system. So you'll see on the bottom right, the term vulva is referring to external genitalia. So this is consisting of the labia majora, labia minora, the clitoris, which opens to the urethra and the vaginal opening. The urethra is part of the urinary system where urine exits the body. Follow the urethral tract up to the urinary bladder. So again, the urinary system we covered a couple weeks ago. Posterior to the urethra, the urethral opening or the meatus is the vaginal opening. So the vagina is a canal that connects up to the uterus. The uterus is a big pear-shaped muscular internal organ at the base of the pelvis. This is where a pregnancy can be housed. An embryo can develop into a fetus, and during pregnancy, this uterus expands way up into the abdominal cavity, getting bigger and bigger, enough to hold a fetus for 9 months. Above the uterus, you'll see a fallopian tube connecting to an ovary. The ovary is where the eggs are stored, released down, travel down the fallopian tube into the uterus for conception. Typically, one egg a month is released during ovulation. And that pretty much covers this slide. And in this image, you see the vagina, the uterus, fallopian tubes, and ovaries. The lower portion here is the vagina. At the cervix is where it transitions to the uterus. The cervix is the lowest part of the uterus. And above that is the corpus. The corpus is the body of the uterus. And at the very top is the fundus. Then you have a right and left ovary connected by a fallopian tube. And the fallopian tube has fimbriae, which attach to the ovary. And on the right-hand side, you'll see a Graafian cell or a Graafian follicle, which houses an egg, and every month it matures and it moves to the very edge of the ovary and connects to the membrane, opening up the membrane and releasing the egg or the ovum into the fallopian tube, follows the fallopian tract down into the uterus for possible conception. During conception, it will bind to the wall of the uterus, and that's where it will mature and live until pregnancy is completed. Okay, let's go over some internal organs and anatomic structures. First off, we have the ovaries. Ovaries are also known as the female gonads, almond-shaped organs in the pelvic cavity. You have a right and a left. They're responsible for the formation and storage of eggs and the production of hormones like estrogen and progesterone that influence or regulate a lot of our female body systems, including the reproductive system. Ovulation would be the release of an egg from the ovaries into the fallopian tubes, which will then travel down to the uterus for possible conception and pregnancy. An ovum is a female egg cell. A Graafian follicle is a sac that contains a bunch of immature ovum, and every month one will be matured and released. Fallopian tubes are a pair of tubes that connect the uterus to each ovary, and it's like a path for an egg to travel. The uterus, pear-sized muscular organ in the pelvic cavity, and during pregnancy, this will house the fetus and is responsible for like menstruation. And then during labor, this muscular organ will help to expel the baby. Endometrium is the inner lining of the uterus. Myometrium is the muscular layer. Perimetrium is the outer protective layer. The corpus is the large body portion of the uterus. The fundus is the round upper portion, so like closer to the abdominal cavity. And the cervix is the narrow lower portion, which is connected to the vagina. We also have some glands here on this slide. The Bartholin glands are mucus-producing glands inside the vagina, just above the vaginal opening on either side. And then the breasts, milk-producing glands. Each breast consists of 15 to 20 divisions or lobules. These are called mammary glands. Mammary papilla is the nipple, and areola is the pigmented area around the nipple. Some combining forms you'll need to know. Cervix, combining form would be cervico or trachelo. Uterus, hystero. Vagina, vagino. Breast, mammo or masto. Ovary, ophoro. And then some combining forms used with the reproductive system may include blood or hemato, water, hydro, white, leuco, muscle, myo, pus, pio. Some prefixes and suffixes for this chapter. A is an absence of or without. These are prefixes. Dis, painful, difficult, labored. Endo, within. Peri, surrounding. And some suffixes. Al is pertaining to. Algia is pain. Seal, hernia or a protrusion. Clesis is a surgical closure. Osis, abnormal condition. Plasty, surgical repair. And rasia is excessive bleeding. So some of these are repeats, some of them are new. Some disease and disorder terms built from word parts. First off, we have amenorrhea, absence of menstrual flow, so no menstruation at all. Dysmenorrhea, painful menstrual flow or pain with menstruation. Endometriosis is abnormal condition of the endometrium. This is where endometrial tissue actually grows outside of the uterus. So in other parts of the body, specifically in the pelvis or the abdominal cavity, including the ovaries, fallopian tubes, even intestines sometimes, often painful disorder. Mastitis. Mastitis is inflammation of the breast tissue. Vaginitis is inflammation of the vagina. And vaginosis, also known as bacterial vaginosis, is abnormal condition of the vagina caused by bacterial imbalances in the vagina, bacterial vaginosis, or BV. Some disease and disorder terms not built from word parts. There's quite a long list in the book, so go over all of them. They're pretty interesting. But some of them that we're going to cover here: abnormal uterine bleeding. This is irregular bleeding, not part of normal menstrual bleeding. A Bartholin cyst is a blockage of the Bartholin gland. Those glands on either side of the vaginal opening can become blocked and inflamed and tender. They can also become infected. Breast cancer is a malignant tumor of the breast tissue. Cervical cancer, malignant tumor of the cervix, most oftentimes caused by HPV infection. Human papillomavirus infection can lead to cervical cancer. Premenstrual syndrome is a syndrome of emotional and physical symptoms that occur typically within 10 days of starting menstruation cycle. Symptoms include nervousness, tension, irritability, mastalgia or breast pain, edema, headache, body aches. Toxic shock syndrome is a severe illness characterized by high fever, rash, vomiting, diarrhea, myalgia, followed by hypotension. In severe cases, shock and death can occur. This mostly affects menstruating women who use tampons and become infected with staph or streptococcus pathogens. Oftentimes, this is from a tampon being left in for too long. Surgical terms. Colpoperineorrhaphy is the suturing of the vagina and perineum. This might be due to damage during vaginal delivery. Episisiorrhaphy, same thing, damage. So suturing of a tear of the vulva. Colpoplasty, surgical repair of the vagina. Hysterectomy, excision or removal of the uterus. Mastectomy is excision or removal of the breast. Salpingectomy, excision of the fallopian tube. Dilation and curettage, widening of the cervix and removal of the contents within the uterus using a curette. A curette is a device used to scrape the inside of the uterus. This might be a scheduled abortion or removal of possible foreign material or products of conception left over after a vaginal delivery. Some diagnostic terms. Hysterosalpingogram is a radiographic image, so basically an x-ray of the uterus and fallopian tubes with the use of contrast. So contrast is injected and they watch the flow of contrast through the uterus and the fallopian tubes. This can be a test to identify causes of infertility. Mammogram is a radiographic imaging of the breast. Colposcopy, visual exam of the vagina using a magnifying tool. Sonohysterography is an ultrasound of the uterus. Transvaginal sonography is an ultrasound of the vagina, uterus, fallopian tubes, lower pelvic area, using a transducer placed within the vagina. Complementary terms. Mastalgia is breast pain. Mastalgia, breast pain. Gynecologist, a physician who studies and treats diseases of women or the female reproductive system. Pelvic, pertaining to the pelvis. Dyspareunia is difficult or painful sexual intercourse. Fistula is an abnormal passageway between two organs or an internal organ and the outside of the body. So it's like a tunneling connecting two organs that aren't supposed to be connected. Speculum, an instrument used for opening of a body cavity for visual examination. So, like a vaginal speculum is a tool that a doctor uses to open the vagina in order to visually inspect the area. Here are some of the abbreviations for this chapter. AUB, abnormal uterine bleeding. PCOS, polycystic ovary syndrome. PID is pelvic inflammatory disease. PMS, premenstrual syndrome. D&C, dilation and curettage. IUD, intrauterine device. GYN, gynecology.